If you have customers that are payers or plans, or would like to, then this video is for you. You're going to want to know about the conversations that were had here around behavioral science, data management, enforcement, personalization, and of course, AI. Oh, and you're going to want to stick around for the really thought-provoking statement that was made by the opening keynote speaker from CMS. You're not going to believe it. This is my summary of the RISE National 2026 conference. Let's get to it. So I have to say, this is my first time at any RISE event, and I can't believe it's taken me this long to come to one. I've always had it on my radar, but the timing just never worked. So thank you to the RISE National folks for allowing me to come down and cover this event. And I have to say, this has been very special, very educational for me. This is my first time at a RISE event, and I can't believe it's taken me this long to attend one. The timing just never worked out, but I'm thankful it did this time because this event has been very educational. I've really enjoyed it. This is the first event I've been to, though, where there was a keynote speaker from the Department of Justice. I've never been to a healthcare conference where that's happened. And let me tell you, this speaker had everyone's rapt attention, especially as the DOJ really cracks down on people who are doing fraud and abuse in the Medicare and Medicaid systems. But the keynote, the opening keynote, was the one that really caught my attention. They had Abe Sutton, who's the director of the CMS Innovation Center, as the opening keynote, and I thought he was really, really intriguing. Not only talking about things that's happening at CMS, of course he talked about the difference and where the volunteer models versus the mandatory models are useful. He also talked about arbitrage a lot, and he spoke a lot about data, which I found really intriguing. Especially around the fact that what he is really pushing for is to make sure that the CMS can gather enough data to prove whether the models and some of their initiatives are actually yielding the results that they intend to. Because a lot of times these plans and initiatives just get renewed and without enough data because they have to keep collecting. So he's really all about making these a lot bigger and making sure that they get the data they need to make a decision as to whether to continue that initiative or not. But the one takeaway from his opening keynote that really struck me and was really thought-provoking was his comment around the future of AI in clinical care. I think it was almost like a throwaway statement, but it was really intriguing to me. He basically said that AI will have a tremendous impact years from now, and that right now, not so much. But years from now, what will happen is that we will go back to a time when you may only need to see a small number of healthcare providers. Abe was basically making a statement that the 20th century has seen the rise of specialists. And the reason why we have specialists and specialties is because of the explosion of medical information. There's been so much innovation, so much new knowledge. It's impossible for one single person to keep track of it all. But now, armed with AI, that actually might be possible. So instead of seeing like 10, 12 specialists in order to get to the answer that you need, in the future, that may be cut down by half or more. Maybe you only need to see 2 or 3 clinicians because each of them will be armed with AI that can maybe give you the answer that you need. It can do the pattern recognition. It can search through all the literature to find out what it is that perhaps give you a better clue as to the root cause of your illness or condition. So instead of getting the runaround to 6 different specialists before the 7th one is the one that gives you the answer, maybe you only need to see 2. And I thought that was so intriguing. I hadn't really thought about that, but I think Abe may be proven right years from now. I hope to be around to tell you whether or not that comes true. Now, I didn't get to as many sessions as I normally like to get to at conferences, and that's because I just found speaking to people in the exhibit hall at RISE National 2026 just so intriguing. There was just so many really interesting conversations. I was asking a lot of questions. And one of the areas that I've been particularly fascinated about is the application of behavioral science and behavioral economics to healthcare nudging and healthcare behavior. We all want to be more healthy, we all should be more healthy, but we're pretty irrational and we need those behavior techniques to be put on us in order to encourage us to do the right thing when it comes to our health. And there were quite a number of companies here in the exhibit hall that were talking about this and exhibiting solutions in this area. There was LimeTree, there was Adhere Health, there was a bunch of others that I'm forgetting their names of at the moment. But here's a clip of my conversation with Chandra Osborn. She's the Chief Experience Officer at Adhere Health, and I think you're really going to enjoy this example that she gives on how behavior science was able to help one particular plan member.
I'll give you one of many examples we have. There was a member that we were supporting last year in 2025. She's in her 60s, she has diabetes, hypertension, high cholesterol. We partnered with her health plan. The health plan reached out to her to introduce her to who we are. So already there, we're trying to create some trust with the member. We noticed, based on our data and our predictive analytics that we have, that she didn't pick up her medication. So we prioritized her for outreach, and our first attempt was to send her a text message reminder. That didn't work. Clearly, being reminded wasn't the barrier that she needed addressing. So we had our clinical team outreach to her and learned that through empathetic listening, motivational interviewing, building rapport, we learned that she was forgetting because she was taking care of her elderly mother. She was prioritizing her health before her own. She also didn't sort of fully understand if her medications were working because for her chronic conditions, they're silent. And so she sort of didn't understand the benefits. And so our clinical care team connected the benefits to her by saying, hey, you know, you take your medications, you're going to be a better caregiver for your mother. And also, too, let's make it easier to get your medication. So we're going to coordinate with your pharmacy, get you auto refills and 90-day scripts. And so that way, this is just easier for you to do. So we noticed she missed a fill again. We contacted her. We learned that her mother was getting more sick. We also learned that she wasn't working as much to care for her mother. So cost was a concern. Food was a concern. Transportation to the pharmacy, leaving her mom, was a concern. So what did we do? We addressed all of those barriers by connecting her with a local food bank, by providing financial assistance guidance, by creating a mail order delivery to her home with her pharmacy. So now we had to address all of those barriers.
Look for that full interview on Healthcare IT Today. Now, while I was here, I'm always on the hunt for unique applications of AI. And here at RISE National 2026, there was one company called RAAPID that had a very unique AI. They call it neuro-symbolic AI. And so I just had to find out more. So here's a clip of my conversation with founder and CEO, Chetan Parikh. And I think you're going to really be intrigued with the benefits of their particular brand of AI.
It's again, as we mentioned, a two-sided, sword. If you undercode or if your AI is unable to identify codes that are truly billable, then you did the work, you provided the service, but you are not getting paid for it. So that's a loss, you left money on the table. On the flip side, where CMS, DOJ, OIG are all very focused on, is to make sure that if you have provided the service, they want to pay you, but you should not be overcoding and overbilling. So with the defensibility, we make sure that whatever is documented gets surfaced and nothing can get, if there's a claim but not enough sufficient documentation, we bring it to the forefront so that the customer can take care of it, either through proper documentation or training their providers on documentation, or remove that code so they are not, seen as being out of compliance. So the technology truly is at the core of making it happen. And what does either the payer or the provider or the patient want? They want a peace of mind that the doctor is able to focus on them the doctor gets paid properly, the doctor is not burdened by compliance issues, and the health plan, which gets the codes from the doctors, are accurate, so they can get compliant and they can get properly reimbursed from CMS. And RAAPID is able to do it because of neurosymbolic AI with much larger accuracy or defensibility and at much larger scale.
Look for that full interview on Healthcare IT Today as well. Now, there was one company here in the exhibit hall I did not expect to see, and that was Hallmark. Yes, Hallmark, the gift card company. I walked by their booth a couple of times and they always had a lineup, but I was super intrigued. Why are they here at Rise National? So of course, I had to go and ask. And here's Marcel Powell to explain why.
Marcel Powell, Hallmark Business Connections. Let me tell you what Hallmark is doing here. It was a great question that you asked. So Hallmark, we're in the Medicare Advantage health plan space. We help health plans with their member communication, their member engagement. We do everything from New Year's cards, AEP, to retention, and everything in between. So we'll send out pre-caps conditioning cards, gap closures for HEDIS, preconditioning HOS cards as well. And a lot of these cards will have a call to action. If they're trying to close care gaps. But something as simple as a birthday card. We have carriers and health plans call us and saying that they had members calling them in tears because it was the only birthday card that they received all year. So, and we've got another product for call centers and in the call center environment, whether it's a utilities company or a health plan, when these members or customers call in and may have lost their pet, that allows customers to send out a sympathy card. We've got 19 different categories of cards and 50 different cards for these customer service reps to send out to their customers. And pause for a second, and we found that this has been great for employee retention as well, being able to empower them to have those moments and send out those sympathy cards. So yeah, in a nutshell, we've got the care platform, just to recap, and then we've got a product called Breakthrough, where we're able to send out one card to many. So if we want to do one drop to 1 million members, we're able to do that to help close those gaps in care for something like colorectal cancer screening, cervical cancer screening, fall preventions, and bladder control, and helping those members get more active and achieve the results that they're trying to achieve. And maybe there's a QR code that drives them to your website. We could customize those cards to meet whatever needs you're trying to achieve.
Like I said previously, what I found most fascinating was the discussions that were being had in the exhibit hall. And I had the chance to talk to a number of the exhibitors about those kinds of discussions that they were having. And here are some of the best.
Hi, I'm Brad Hawkins. I'm the Vice President and General Manager over Payer Solutions here at MRO. Here at Rise National in Orlando, Florida, having a great week, getting an opportunity to interact with health plans that we serve, as well as partners that we're working with collectively, ultimately to accelerate data exchange. If you think about who we've been for the last 25 years, we are working with providers on a daily basis to exchange clinical data with health plans and other requesters looking for information, primarily here at Rise, to drive what? Risk adjustment and HEDIS, so really quality care gaps. And so a lot of the conversations have been driven around how can we accelerate data exchange? How do we lower the barriers to getting that data? How can we create a more strategic way to exchange data, be that through HEDIS supplemental data feeds that we can get from providers to improve quality, so you're not waiting to the end of the game to see what the score is, but you're measuring along the way throughout the year. But yeah, appreciate Rise for having us. Appreciate you, Colin, for giving me a little bit of time to give me my spiel. But it's been a great week here at Rise, and we're looking forward to participating in the future.
All right. Hello, my name is Lee Mitchell. I am here at Rise 2026 with InterSystems. And we are here today talking to customers about interoperability and clinical data management. And I'll hand it off to my coworker, Carrie Lockhart.
Hi, I'm really excited to be here. Carrie Lockhart, I'm a Customer Success Manager here at InterSystems, and I have the pleasure of sharing some customer stories later today on how to build an enterprise-wide clinical data asset and the journey to get there.
Hey everybody, I'm Chaz Wazalowski, Account Executive here at InterSystems. One of the big things I'm excited to talk to members here at RISE about is kind of taking that step back, from traditionally looking at a legacy claims-first approach to risk adjustment, really moving that operation upstream to take a look at weaponizing clinical data to help pick up on HCC signals sooner, help to be more aggressive in the ways that we design intervention plans and address care gaps to improve membership outcomes.
Hi, Colin. My name's Jim. I am the VP of Sales for Lirio on the payer side. We're at RISE Convention in Orlando. Very excited to be here. Yeah, so most of the people on our side have been very interested in the personalization that Lirio provides. With the venture of agentic AI and behavioral science and the combination of the two, we've created an N of one situation where we're actually able to personalize nudges or messages out to patients and member population that is hyper personalized. So it literally speaks to each individual. What happens is we create a cadence. And so as each of those messages go out, whether or not they interact through text or email or in-app notification, even with an IVR and a chatbot, as we get that information and that feedback loop comes to us, our agentic AI learns and creates a bigger and better profile for each individual patient member.
Good morning, my name is Chris Kasman. I am the Director of Strategic Relationships here at ELLKAY, specifically in the payer space.
Hello, my name is Scott Frazee, Vice President of Sales for our payer team and our hospital and health system team.
With RISE, we're working mainly with the payers and the vendors that support payers to be able to help them aggregate data from their providers. So payer-provider collaboration to share information to support HEDIS, risk adjustment, utilization management, whatever the use case is, being able to help build that collaboration so clinical records can be shared more efficiently, quickly, and the ability at a higher quality level.
All right, well, I am Katie Holcomb with Surescripts, and I'm here at the RISE National Conference here with Kelly Hardison, my colleague in sales at Surescripts, and we are really enjoying ourselves with all the conversations with a lot of people visiting our booth from a lot of different areas across the healthcare ecosystem. So Kelly, I would love to know, what are some of the big themes that you're seeing here today at RISE?
Yeah, that's a great question, Katie. We've had a very busy booth, and a lot of the conversation has been around STARS measures. And one of the main key concepts within that has been adherence.
Yeah, one theme I noticed has been about how we have the ability to identify the members that are at risk. So we can help health plans target the right members at the right time, and even before they've even joined the health plan. So we can help with the onboarding process and everything. So we've had some really good questions around that too.
Yes, yep, for the medication history, and then also cohort of that population for prescription notification.
Yes, and the clinical intelligence alerts too.
Yeah.
That's been a big theme as well. So.
In conclusion, I just want to give a shout out to the RISE team. This conference was excellent. Everything ran smoothly. Their food game was definitely on point. Thank you for having all the healthy snacks and all the snack stations around. Those were really helpful, especially for us that don't get around to eating proper meals. That was very well done. The venue was amazing. Thank you for ordering all this beautiful sunshine as well. But I really appreciated some of the smaller touches as well. There's that beautiful sign behind me. They also had a lot of places where you could take a phone call in quiet. That was very nice. Charging stations as well. But I really like the give back opportunities here. There was a painting station where you can paint some paintings that would go to some local charities. There was also an opportunity to fill some food bank items into some bags for a local charity. So I thought that was a really nice touch as well. So overall, I have to say I'm very impressed with this conference. I found the discussions here to be very nuanced. I learned so much. I have so many questions, and I just want to thank everyone that allowed me to talk their ear off and ask them all the questions as I learned more about this area of healthcare. Plans and payers, it is so nuanced. what they do, and there's so many challenges that they face. I definitely got an education, and I definitely appreciate that. And like I said, if you are planning to target payers or plans, this is a conference you definitely need to be at. And hey, if you made it this far in the video, we would really appreciate it if you mash that like button and click subscribe. Also, head on over to healthcareitttoday.com where you can find more great content like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.